Hi, this is Dr. J. Varma, and welcome to Thermometer. On this show, I check the temperature of public health in the US and around the world, and I give you expert insights on infectious diseases and public health. Sometimes it feels like viruses are everywhere: monkeypox, Ebola, polio, COVID, measles. Every week, there's another headline about the next big outbreak. But here's the real question: are there actually more outbreaks now than ever before? Or are we just paying more attention? As a doctor, epidemiologist, and someone who has spent decades fighting infectious diseases globally, I want to cut through the noise and explain what's really going on. Let's start with the facts. Several forces are colliding right now to make it seem like the world is in a constant state of outbreak. Some of those forces are new, and some of them have been building for decades, and some of them are completely out of our control. But together, they're creating a perfect storm. First, let's bust a myth. Most new diseases aren't actually new. These diseases have been around in animals for ages, but they've only recently made the jump to humans. We call this jump a spillover event, when a virus or bacteria in animals finds a way to infect us. HIV started this way. COVID likely did too. But why are we seeing so many of these spillovers from animals into humans right now? There are 5 key reasons for this. First, we're invading animal environments more than ever before. The most dangerous place for new diseases to emerge isn't a laboratory, it's at the edge of forests and jungles. This is where humans are cutting down trees and pushing into wild ecosystems. The animals that thrive in these disturbed areas, rats, bats, mosquitoes, are also the ones most likely to carry deadly diseases. And the closer we get to those areas, the more chances those diseases have to jump into us. The second reason is we're farming, trading, and eating more animals than we ever have before. As economies grow around the world, so does the demand for meat. More animals are packed into farms, more animals are shipped around the world, and there's more chances for diseases to spread between them and to us. And this is how we get things like drug-resistant superbugs, bacteria that evolve in factory farms and that make their way into our food and our water. Third, we're living closer together. If you want a disease to spread easily, pack people into small spaces. That's exactly what cities do. The world is more urban than ever, and many of our biggest cities were shaped by past epidemics. But as cities grow, so do the opportunities for new pathogens to spread, and to spread like wildfire. Fourth, we're traveling more than ever. The US city with the most international connections? New York. So it's no surprise that New York was hit hardest and fastest by Zika virus, by COVID-19, by monkeypox. When people and their germs move fast, diseases don't stay local for very long. And fifth, climate change is making all of these factors worse. Floods, droughts, rising temperatures, they don't just affect humans, they push animals and insects and the bacteria and viruses that travel with them into new areas. That's why we're seeing diseases like dengue and malaria showing up in places that were never considered tropical before. It's not just a public health problem, it's a problem for our entire planet. So what does this mean? Does this mean we're doomed? Not necessarily. We actually have the power to act, and we've proven this before. Human beings wiped an entire deadly disease off the planet, smallpox. We turned HIV, what was once a 100% fatal disease, into one that's highly treatable and preventable. We have drugs to cure some of the most deadly infections known to man. So what this does mean, however, is that we have to think differently about how we protect ourselves. And here are some things that you can do right now to stay safer. First, vaccinate yourself and your family. If a vaccine exists for a disease, strongly consider getting it. Vaccines are the single best tool we have against outbreaks. Second, of course, try to stay as healthy as possible. What does that mean? Well, it means the stronger your body is, the better it can fight immune infections. Eat well, exercise, Manage your chronic conditions like diabetes or heart disease. Managing all of those things well are one of the most important things, other than vaccines, you can do to strengthen your immune system. Third, stay informed, but don't panic. Knowing what's coming helps you prepare. It's like a fire drill. Thinking about what you do in a severe outbreak makes you less anxious and more ready to face whatever might come. And finally, and this is really important, push for policies in your communities that strengthen public health. Contact your elected officials. Tell them that you want them to support the detection of new diseases, improving healthcare access, combating climate change. The more you speak up in your communities, particularly to your elected officials, the better we're all going to be prepared in case a deadly disease emerges. We're living in an era of emerging infectious diseases, but we're not powerless. The same human activities that increase disease risk, travel, urbanization, food production, can also be reshaped to protect us. So if you want to understand infectious diseases and public health without the hype, subscribe to this channel, Thermometer. I'll be here every week breaking down the headlines, giving you the facts, and helping you make sense of the world's biggest challenge. I'm Dr. J. Varma. Stay safe, stay informed, and I'll see you next time.